honoring the past, celebrating the future. While we celebrate the 50th anniversary of Community Health Centers in America, tonight we highlight the 40th anniversary of Community Health Centers right here in Columbus and the 18th anniversary of PrimaryOne Health. This significant milestone celebrates the beginning, development, and current state of health services available to our community here in Central Ohio.
This is a really important and historic year. Not only are we celebrating across the country 50 years of community health centers, just like PrimaryOne Health, all across the nation, every single day helping people right in neighborhoods get the best care possible. But it's also front and center of making sure people who have never had health insurance before have the chance to enroll and get good quality health care. You know, the Affordable Care Act really puts health centers front and center of the delivery of best health care. And PrimaryOne Health has been doing it for 18 years and going strong, and is one of the few places that really combines mental health with all the other kinds of direct health care that people right in any neighborhood need.
We're celebrating 50 years, and one of the hallmarks of the program is that the program is designed by the patients, for the patients, with the patient's voice at the table. So our federal charter requires that 51% of the board members of PrimaryOne Health and any federally qualified health center be made up of patients. The services that we provide, where we provide those services, and the hours that we provide those services are decided by patients and other board members.
Here we are in 2015 under the special designation of a federally qualified health center entity with 10 locations offering primary care, specialty services, mental health services, again, all serving people who want quality primary care right where they live, right where they work, and again, very rooted in our Columbus history.
With PrimaryOne Health, patients in the Central Ohio community are provided with primary health care and support services which not only enhance the health and well-being of the individual and their families, but also promotes our belief that a community cannot call itself great without improving health outcomes so that children and adults are ready to learn and ready to earn.
I love particularly working at PrimaryOne Health because there's a sense of belonging. Patients come from local community. You feel that you belong to them and you have a personal relationship. I know my patients, I know their families, and it's something that goes beyond patient-doctor relationship, and that's what I enjoy the most here.
I came from Ohio State University to join an FQHC for many reasons, one of which is the care which we provide our patients. Our mission is to allow access to care to anyone who has barriers. We've been able to do a great job with that through multiple resources that we bring.
PrimaryOne Health provides basic primary health including dental, vision, behavioral health, and OB/GYN for its patients and community, and specialty services like dietary education, physical therapy, and cardiology services. These services are provided to over 35,000 patients annually.
Well, we're really excited about the new options that are available to our patients. One area is integrative health. One of the critical factors of mirroring up behavioral health care with primary care, operating from the same set of standards for each, but both complementing one another. So when a patient checks in and gets help for a general screening of an issue, they're able to receive some mental health counseling probably right there before they meet with the primary care doctor alongside a primary care doctor.
As you may or may not know, in Ohio, in the state of Ohio, and particularly Columbus, we have some of the highest infant mortality rate in the nation. PrimaryOne Health has taken the lead role in making sure that those numbers are dealt with and reduced over the next few years. Many of our centers in which we serve have patients in the so-called targeted areas. And so what we have done is we have made sure that those patients who are in the targeted areas have access to prenatal care, have travel arrangements, and have barriers that are removed so that there are no reasons why those patients can't receive the quality care that they so deserve.
Each year, the United States spends billions of dollars in healthcare costs for uninsured residents, from soccer moms to grocery store clerks, children, and seniors. Often, these costs are for preventable diseases or illnesses easily managed with efficient treatment and early diagnosis. We believe that every resident in Central Ohio deserves these basic services. Services like physical therapy, where we have state-of-the-art physical therapy equipment and skilled physical therapy staff available at our PrimaryOne Health site located in the John Maloney Building at 1905 Parsons Avenue that provides services for individuals recovering from surgery, stroke, or injury. And where men and women can learn about nutrition, proper diet, and food preparation techniques from trained dietitians in our commercial kitchen classroom.
We are one of the very few FQHCs, federally qualified health centers, in the country that offer physical therapy. And we're capable of treating many conditions here, from musculoskeletal to neuromuscular, cardiac rehab, pretty much any system that you would treat in a typical outpatient basis. So essentially we are establishing the model here at PrimaryOne Health in Columbus, because we don't really have another model to follow in terms of billing and logistics and how the physical therapy clinic will run.
Or like the PrimaryOne Health site at 1180 East Main Street, where dental disease prevention and treatment is possible for patients who need it. And vision care, with a full optometry suite where patients are provided with eye exams, diagnosis, treatment, and frames and lenses at our full-service vision centers located at both our East Main and West Side location at 2300 West Broad Street. And for our residents in Pickaway County, we have a PrimaryOne Health site in Circleville to provide primary and specialty services.
We are one of very few vision centers that are incorporated within an FQHC. Less than 17% of federally funded health centers actually have a vision center, so we're unique in that way. We have a comprehensive set of doctors. We have 3 doctors that operate within the system. We all provide comprehensive eye exams, including a full optical. We treat emergencies, and we also treat many eye diseases and act as a referral system.
The uniqueness about PrimaryOne Health is that we have many services that other health centers don't offer. And that was the unique thing about vision. In the beginning, 18 years ago, we were one of 2 in Ohio that had vision. And sad to say, there's still very few vision clinics with FQHCs. So that's one uniqueness. We also have grown over the years. We started out very small, and over the years we've grown to add 2 other optometrists as well as another health center.
10 sites providing high-quality, comprehensive care, support services, and staff that are dedicated to helping people and providing top medical care to our patients. Our support staff of nurse practitioners, nurses, lab techs, and administrators provide top-notch care the entire year round. These dedicated professionals, led by our board of directors, make a difference in our community every day.
Being a board member and patient is kind of unique in itself, where I get to see what the patients, what their needs are, where they have issues, and we get to sit at the table and address those issues on a monthly basis. Being a patient, I'm getting my health care and all of my needs addressed at the same time. But even when I have issues and I see things that other patients see, I can also bring those to the table at our monthly meetings to have those issues addressed.
What's unique about being on the board is that I'm a patient, and 51% of the board are patients, and they come from diverse backgrounds, ages, gender, and by being that, I think we have good input and insight on how a patient should be treated.
PrimaryOne Health has expanded our partnerships to ensure that we're providing for all of the needs of our patients. We have partnerships with the Mid-Ohio Food Bank to provide fresh fruits and vegetables, partnerships with Columbus Public Health, providing dental services, and certainly STD and other kinds of surveillances of diseases and illnesses. We also have partnerships with the Central Ohio Diabetes Association to provide comprehensive education around diabetes. We have expanded our care, but we've also ensured that we've expanded health care, health insurance, with our certified application counselors. These are individuals that help individuals within our community enroll into Medicaid or the market exchange. And we are a part of the Southside Renaissance here on our Parsons Avenue location, which is in the John Maloney Health Center. We have a partnership with the Reeve Avenue Center and the resurgence, the renaissance of the south side of Columbus.
We were fortunate that PrimaryOne Health asked us to be part of this Southside initiative. And Jamie started very early in the process, several years ago, getting involved with educating about our moms-to-be and about infant mortality, and I'll let her tell you a little bit more about what she did and has been doing here on the South Side.
Yeah, so we've been planning our site here at the South Side for a while. Before we actually started, I went to some different community meetings, including the Ohio Equity Institute, and got to really make some contacts here in the Southside community, which has been a huge help when moving forward and forming our Moms2Be site. So we've been around here on the South Side for about almost a year and a half now. We started in July of 2014, and it took us a while to really kind of get some momentum going. But now, over the past 6 months or so, we've really got a steady group of pregnant women and parenting women involved in our program. We've had probably about 20 babies born in the program so far. So it's really picked up momentum, and we have a really great group going right now.
We are incredibly grateful for our partnership and collaboration with PrimaryOne Health. When Matt Habash, Mid-Ohio Food Bank CEO, and Charlita Taveras got together, they truly understood that food is health and the connection between food and health.
Through partnerships like this, we're able to make sure that all have access to the fresh fruits and vegetables that they need so that they can lead healthy lives.
You know, the whole face of hunger has really changed in our community. It's our coworkers, it's our neighbors, it's who our kids go to school with. And so by collaborating with PrimaryOne Health, we truly are able to look and work with the whole person. PrimaryOne Health helping to address the healthcare needs, and Mid-Ohio Food Bank addressing the food insecurity needs.
PrimaryOne Health is one voice, one system, and we want to be your first choice for quality care.
For 50 years, community health centers have made a difference in America. 40 years in Columbus and 18 years with our healthcare system, PrimaryOne Health. Each day, the board and staff dedicate ourselves to honoring our past and celebrating our future. Make a difference today with your donation to PrimaryOne Health in Central Ohio. Join with our community partners in making Columbus and Central Ohio great. Make your pledge today. Your philanthropy supplements our annual budget to provide services and care to more patients who do not have insurance, needed supports, and/or medication assistance.